Big Pharma and government have vested interests in keeping American citizens sick. Agree or disagree? Well, that's the topic of today's Bold and Blunt. And I'm your host, Cheryl Chumley, giving you a Christian conservative look at today's news, politics, culture, and events. Look at the revenues that Big Pharma makes from its pharmaceutical industry, right? Look at how much money is generated by the healthcare industry in America. How much goes toward profits? How much goes toward research and development? How many of our tax dollars are funneled into the healthcare industry, making its way into the pockets of Big Pharma executives and government bureaucrats like Anthony Fauci, who we learned profited from the development and sales and so forth and marketing of the COVID shots. So there's a lot of money to be made in the healthcare industry. And at a certain point in time, you have to wonder, do these people who profit so heartily off sick American citizens really want American citizens to be healthy? It's kind of a cynical question, but then again, it's the same question that plagues the industrial military complex, right? People wonder if wars are started, created, and expanded around the world just so the military manufacturers, the military product manufacturers can continue to make money. It's questions that have to be asked, right? Especially if you look back under the coronavirus and you find that some of the very same players who were hyping the need for, say, COVID shot and COVID booster after booster after booster were the ones who were raking in the big money from the sales of COVID shots and COVID booster after booster after booster. And before I get into more of that, I want to quickly mention, if you like Bold and Blunt, you may get Bold and Blunt at edify.app, at washingtontimes.com, where you can also subscribe to my 3 times a week newsletter. It comes out Monday, Wednesday, and Friday. Go to the bottom of washingtontimes.com, hit on the newsletter section, and find my newsletter, Bold and Blunt with Cheryl Chumley. Type in your email, and you will be subscribed. You'll get my commentaries that I write every day at the Washington Times, as well as my Tuesday and Thursday Bold and Blunt podcast, which you may also get at Real Life Network, the faith-based news arm of Pastor Jack Hibbs' church in California, or you may get Bold and Blunt wherever podcasts are offered. Big Pharma raked in US dollars $90 billion in profits with COVID-19 vaccines. That is a headline from just this February from SOMA, which is the publication of the Center for Research on Multinational Corporations. Pfizer, BioNTech, Moderna, and Sinovac, I'm reading from this article now, made an extraordinary $90 billion US dollars in profits on their COVID-19 vaccines, which vaccines, by the way, remember, redefine what vaccines do and are in America. So they no longer, you can no longer assume that when you take a vaccine in America that it actually stops you from getting that disease or virus or stops you from spreading it, but it's sort of, kind of, maybe, perhaps, potentially, to use Anthony Fauci's favorite phrases, potentially could stop it. Profits on their COVID-19 vaccines and medicines in 2021 and 2022, $90 billion US dollars, okay? Reading more from this SOMO piece. SOMO's new report, Pharma's pandemic profits, shows that these enormous gains are largely due to decades of research funded by public investment. That's code for tax dollars. That's code for your money and mine. Along with billions in grants for development and production, which grants can also include tax dollars, just to let you know, maybe a little bit more indirectly than just government allotments, but still could be public investments, and tens of billions of dollars in advanced purchase agreements with governments, which is the use of more tax dollars. Isn't that interesting? Wow, thank you, Joe Q, taxpayer, for funding these COVID shots that yielded $90 billion in profits for Big Pharma. Pfizer alone, reading again from SOMO, generated $35 billion in net profits on its COVID-19 related products during 2021 and 2022. BioNTech and Moderna made $20 billion each, while Sinovac pocketed a comparative measly $15 billion. Wow, poor Sinovac. Living in the poorhouse, huh? As health policymakers globally review the lessons learned during COVID-19, it is imperative that they agree on strong measures to prevent such extreme profiteering at the expense of taxpayers in the future. At the expense of taxpayers. That's key, right? I'm all for capitalism and the free market. I'm all for businesses starting from nothing and growing over the years to make billions of dollars in profits for their CEO, for their boards, for their employees even, right? That's the American way. That's great. But Big Pharma is not the American way, because using tax dollars in any shape or form to any degree, whether small or large, pockets of tax dollars sort of steps you outside the capitalistic free market and puts you more into the box of publicly funded, right? And there is a lot of crossing nowadays. There are a lot of blurrings of lines between what is, purely free market versus what is taxpayer funded. But these COVID shots, by and large, thank you, taxpayers, right? Big Pharma needs to be sending us all big Christmas gifts, big thank you notes, because we really patted their pockets, didn't we? The Pandemic Accord, reading again from SOMO, a new international instrument on which negotiations recently started. This was in February, remember, recognizes the need for governments to attach conditions to public funding of medical research and development. However, the draft text published earlier this month falls far short of making conditions on pricing, profit margins, and equitable access mandatory. I can't say I'm in favor of a global entity controlling prices of medicines, not just in America, but around the world, especially in America, where we have the free market, right? Leave that for the governments of other nations that are headed by Marxists and communists and so forth, where government does control pricing and government does control the means of production and so forth. Here in America, it's supposed to be free. So the problem here should not be solved by creating more government controls on the free market, but freeing up the market so that Big Pharma is forced to compete within the free market, right? And not so reliant on tax dollars. Because what happens is, when you use tax dollars, that is a pool without an end. You can keep dipping and dipping and dipping so long as you can convince those in charge of the dipping process, those who can grant you entry into the pool of resources, so long as you can convince them of the need for those resources, then you can just keep on dipping, right? It's endless. Tax dollars, that's great. It's great to be funded by tax dollars because you don't have to worry about dipping into your own bank account. Why stay within the confines of your own budget when you can have an endless budget called taxpayer coffers? And when you have somebody like Anthony Fauci in charge, right, of allocating here, allocating there, deciding who gets funding for this medical research versus who gets funded for that scientific advancement, then really it all comes down to this. Are you friends with Anthony Fauci or not, right? Are you friendly with the correct people? Are you buddies with the powers who be that you need to be friendly with? When it's paid by taxpayers, all you have to do is know the right people, make the right case on your grant application, show the right need to rob Peter to pay Paul, with you being listed as Paul in that equation. And the money can flow, right? And fear is a great generator of perceived need. The fear was hyped under the coronavirus. We had to rush, spend, use tax dollar after tax dollar after tax dollar, because people could die, as Anthony Fauci and Bill Gates kept telling us, right? So we needed to rush out development of the COVID shots. And Big Pharma, happily, was there to take the tax money and develop these shots that we learned after just a few short months that the lab experiments, the clinical test for efficacy, which is what efficacy is anyhow, to determine the success rate of a shot in a clinical setting, was not quite what was matching up as the months went by in the real world setting, right? So they're not as effective as what was promised. But hey, for that, we can change the language. We can change the definition of vaccine and vaccination. No problem here. Nothing to see here. Go home, folks. There's another chart I'm looking at right now from Statista, I'm not sure how to pronounce this, Statista, Statista. Sales revenue of the 20 best-selling drugs worldwide in 2020 by illness, given in billions of US dollars. So this was before COVID, right? And before the Big Pharma windfall from the COVID shots. In the United States, cancer research, cancer drugs, including blood, breast, and prostate cancer, generated more than $40 billion in US dollars in revenue in 2020, in 1 year. Looks like, maybe looking at the lines on the chart, maybe about $42 billion. $42 billion in the United States went toward the purchase of cancer drugs. Autoimmune diseases. In 2020 alone, the United States spent about $28 billion on drugs to fight various autoimmune diseases. In 2020, the United States spent about $11 billion for drugs and medical treatments to fight heart disease. In 2020, about $5.5 billion, maybe $6 billion, went toward the purchase of HIV drugs. Maybe about $4 to $5 billion in 2020 in the United States went toward purchases of drugs to counteract diseases of the eye. About $4 billion went to purchase drugs to fight multiple sclerosis, MS. That's all in 1 year, right? 2020. About $3 to $4 billion went toward the purchase in 2020 in America for type 2 diabetes drugs, and pneumococcal disease is the last one on this list. Maybe about $2 to $3 billion in 2020 in America went for the purchase of drugs to fight pneumococcal diseases. So it's a multi-billion-dollar industry. And that was all before the windfall called COVID shots. So again, when you look at Big Pharma, when you look at the medical community and the government players who are tied to Big Pharma, who profit when Big Pharma profits, right? When you look at all that and you consider the massive amounts of money that go into feeding this beast called healthcare in America, tax dollars that go into feeding this beast, you have to wonder, if everybody in America was healthy, would these Big Pharma and their government players be happy with that? Or would they look for something else, some other disease to come up with, that we need to get the shot, we need to get the vaccine, we need to do this, we need to purchase that? If you look at it from a purely profit and loss perspective, it is advantageous for Big Pharma and their players in government for Americans to be sick. Sad to say, cynical to say, but factually true. And I have a guest with me today, Dr. Mark Richards. He has served in White House administrations, both Republican and Democrat, which makes him completely unbiased, or at least more unbiased than, say, Anthony Fauci and some other medical bureaucrats who are known donors to Hillary Clinton and other Democrats. And he's written the book, Nobody Wants You Healthy, Achieving Better Health by Avoiding the Corruptions in Modern Medical Science. Sounds a very important read for these coronavirus crazy times. Mark Richards, thank you so much for being on Bold and Blonde. It is great to have you here.
Thank you.
So I want to talk about your book titled Nobody Wants You Healthy, but I wanted to sort of lay a basis for discussions because you served in the White House as a medical professional under both Obama and Trump. So my guess is that you are more medical science and far less political.
That's absolutely true.
Okay, so when you look at the world of the coronavirus lockdowns, what was your general takeaway from what the government did?
Wow. Well, my takeaway is that I was horrified because as a scientist and as a physician, there's two things that are key foundations for what we do and what we believe in and how we should behave. The first one is that there is no science without scientific debate. Everything in science needs to be questioned, debated, for years on end, and that's how we get to better understanding of the truth. And so, essential criminalization of scientific discussion of dissenting opinions was something I never thought I'd see in this country. That was my first takeaway. My second one was after World War II, we convened an international tribunal in Nuremberg. And one of the byproducts of the Nuremberg trials and the Nuremberg Code was to create a framework that all nations would agree to so that unconsented human experimentation would never again happen. And if you look at the code, the first requirement says voluntary consent of a human subject is absolutely essential. This means a person involved should have the legal capacity to give consent, should be situated so as to be able to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior form of constraint or coercion. And we had a situation where people would not be able to work, travel, etc., sometimes go out in public. Other countries imprison people that refuse to take a untested, basically experimental vaccination. Regardless of whether the vaccination was the best thing ever created or not, and that's a whole other discussion, forcing people to do something that's untested, injected into their bodies, is not ethical. So those are probably the two foundations that were knocked out from scientists and physicians who swore an oath to deliver the best possible care to their patients.
I was horrified as well. I was horrified when, toward your first point, when Anthony Fauci came out and said if you attack his views of the coronavirus, then you were attacking science. And I was horrified that not only were the mandates for these shots put into effect in the military and in many businesses in America, but they're still ongoing. The face mask requirements are still ongoing.
It flies in the face of science. When I wrote my book, Nobody Wants You Healthy, Achieving Better Health by Avoiding the Corruptions of Modern Medical Science, I purposely never mentioned COVID once in my book, even though, of course, it would be unnatural to fit in there. But the reasons were twofold. One, the environmental poisoning that's been going on for 5 decades drastically decreased testosterone production in the general population. And testosterone is the most abundant hormone for both men and women their whole lives. And in fact, testosterone is responsible for controlling inflammation and for moderating metabolism. So without testosterone, you become inflamed and develop all sorts of chronic diseases from dementia and cognition issues to heart attacks and strokes. And you develop metabolic problems such as diabetes and obesity. And we're seeing epidemics of this. And that environmental poisoning kills and injures far more people than COVID ever will. And the second reason that I didn't mention COVID was because, as you point out, democracies across the globe were actively censoring and punishing scientists and physicians for even mentioning facts or giving opinions contrary to what the government and the pharmaceutical industry narratives were. So I didn't want my message to be diluted, and I didn't want the book to be censored because it mentioned truths that people didn't want to hear.
So the fear is being drummed up again, as I'm sure you realize yourself. Anthony Fauci in the last week making the rounds about COVID case counts again, which I'd like you to speak to the fact that just the case counts themselves are meaningless, right? But also that there are too many people walking around by themselves, in their cars by themselves, down the street by themselves, wearing face masks. And it just tells me that the foundations are laid for fear once again to be used as a successful political tool by the left to seize our liberties. Do you see it that way as well?
Sadly, I see it that way, but not so much with the purpose of seizing our liberties. I think it's more basic. I think they have two objectives in what one commentator called fear porn. The first is there's trillions of dollars slushing around, and the people that were sucking it out of the system to enrich themselves really don't want to be discovered and are looking for a second injection of cash. And the second point, and probably even more important, is that the people who were in charge used false science that they knew was false at the time. They lied to the public, and they back themselves into a corner where they can't really let out, because any reversal of policy is going to lead to a discovery of the fact that they were lying to everybody in the first place for whatever reasons those were. Typically, it's for the cash. So they're stuck. They need to ramp up this whole fear again. For them, I don't think this is going to happen a second time. The vast majority of the population understands that, as the Cochrane Library science researchers had proven with 6 studies since 2006, masks are completely worthless for stopping the spread of viral illnesses. I mean, that's absolutely known. It's fact. It's been proven. Also, lockdowns, we learned 100 years ago, and public health scientists have proven it time and again, do not stop the spread of viral illnesses, respiratory illnesses. They just don't, because you're airborne. So the methods they employed the first time were already proven to be ineffective, but they got away with it. And it's sort of the, fool me once, shame on me. I mean, shame on you, fool me twice, shame on me. And I think the public wised up, and they realized, one, the vaccines weren't stopping people from getting sick. Two, the risk of the vaccines versus the risk of COVID needed to be looked at. And in many cases, people, could look at the science and figure out that perhaps the government mandate was not in their best interest.
I would truly like to believe you, because yours is the much more optimistic message. But part of my hesitation to jump on board with that optimism is the fact that the media was very much part and parcel of selling the fear. And you don't have many in the media apologizing or even acknowledging mistakes. Do you recall, and I'm sure you do, the many media outlets that ran in their bottom right or left-hand corners the entire coronavirus beginning months, case count, and you would see the number go up and up and up, and it was like a constant hysterical fear being drummed.
You know what? I do, and it was deceptive.
Yes.
And the media was complicit.
Yes.
Not the media, thank goodness, but the vast majority of the media was very complicit in it. Mark Zuckerberg's on the record in a congressional hearing saying, yeah, we censored people that were telling the truth about the vaccine and the virus, but the government was calling us and saying if we didn't cooperate, they could make things difficult for us. So, again, they're sort of caught now. What does the media go back and say? Hey, you know what? We really drummed it up, and we were under pressure, and we really lied to you. Already, they have an 18% public trust rate. I mean, I don't know how much lower it could get. I think as as people rely more on independent media and more conservative or factual media, I think they're going to learn how many studies have come out from all sorts of places around the world showing that indeed, lockdowns, masks, vaccinations are not necessary for the vast majority of people globally. And as they learn that through these other sources of media, I think it's the minority of people, even in my very liberal county outside of Maryland, there's a tiny minority of people that are wearing a mask.
In some areas of the country, they just put into effect mandates for school children to wear face masks. And, I just find it disgusting because, as you point out, the studies not only are here now, but they've been there for a very long time. And I just wonder, what would be your response to, say, the federal government coming out and putting face mask requirements again as conditions of flying in America? How would you go about knowing that this is a total lie? How would you go about resisting that if you needed to fly?
Well, sadly, in a police state, you can't really oppose the government by yourself or you get tossed in the can. So that's not going to work out, but you certainly can take it to court. And just as, as what three-judge federal panel determined that the federal government was violating freedom of speech rights of citizens when they were censoring media. It takes a long time, and people have to be accountable. I ultimately, since there was a complete violation of the Nuremberg Code, which is part of the international law that all countries have agreed to, I would like to see one day all of those who violated these basic human rights explain their answers, at the International Court of Justice at The Hague, because this is a global problem. And there's countries that are furious that they were duped by the Americans and pushed this vaccine, which now is causing long-term issues that they had no idea about in the beginning. So, there is no short-term solution, Cheryl, and that's the problem.
Yes.
When the government decides to use its immense powers to force you to do things that are unconstitutional, you don't have, as an individual, a rapid solution. You have, as a group, a long-term solution, which is to take it to the judiciary branch.
Right. And hope that you get a judge with common sense and not a radical. So just a couple issues to touch on about your book, specifically, Nobody Wants You Healthy. You talk about health as an economic and national defense issue as well. Could you explain?
Sure. The problem, it's economically, the problem with chronic diseases is that it benefits the pharmaceutical industry to the point where 90% of the $1.4 trillion in annual revenue pre-COVID was going to treat but never cure or prevent chronic diseases. And the largest benefits of the lobbying efforts of chronic diseases is, of course, the federal and state government politicians. So they are the largest lobbying group by a factor of 2, so they tend to get favorable policies. The FDA, which is supposed to oversee medications coming out, doesn't have the staff to really do statistical analysis of the studies, and they just accept what the drug companies say. The NIH scientists have intellectual property rights that they share with drug companies pushing a new expensive drug, so they get paid. So the result is that now we have 75% of peer-reviewed journal articles are not reproducible in independent labs. In other words, they're false. Now, when 96 cents of every Medicare dollar and 80 cents of every regular healthcare dollar in the U.S. goes to treat chronic diseases, and you're creating an epidemic of chronic diseases, you're going to bankrupt the system. You're also going to create a population that has cognitive issues, that has mood disorders, that has an inability to be fully productive, and in the military case, has an inability to really defend our country because they're just physically and mentally not the fighters that we used to have. So there's national defense issues, there's economic issues, and it really is the decline of the American empire.
Wow, that's pretty dark, but truthful, very truthful. I wonder if in your book, Nobody Wants You Healthy, and just to finish up with this question here, you explored the mind-blowing amount of science that has been deceptively pushed in the last 100 years by scientists who supposedly have brought forth truthful findings, and then you only to find out years later that they purposely lied in their findings and their data was skewed on purpose. I've researched during the coronavirus how many scientists have actually been outed as being liars, and I'm astounded that this isn't put forward more. Did you put a chapter in your book on that?
Well, I did. It's sprinkled throughout the book at what previous studies had said. I try to focus on the positive and say, look, this is a good study. This is what it showed. Here are the results. This is what we can do to improve that chronic condition. But the last chapter of the book is Why Nobody Wants You Healthy. And it explores the financial incentives and the simple human ego and hubris incentives for people to be fraudulent in their studies and in their articles that they publish. And it's human nature. It's the bad part of human nature, and that's not going to change. So guidelines need to be in place to prevent that from happening. And that's supposedly what the administration of our government was going to do. It was going to appeal to the better animal and the humans so that these sort of frauds would not be perpetrated. And instead, with this massive amount of money going to the politicians and our regulators getting huge jobs in the industries they regulate after they leave the government position, we don't have that. We have corruption. And it's a lack of ethics. It's a lack of morals. It's corruption that's endemic in the system of how much money they can get for themselves and how much better they can get, with a total disregard for the safety and even the lives of their fellow Americans that they were supposed to be protecting. I'm sure there's some that were misguided or fooled, but the vast majority of them aren't even thinking about it. They're looking for their own best interests. And it boils down to ethics, and beyond that, I don't know what you can do, Cheryl.
Well, that's why, in America at least, it's always supposed to be about individual choice and decision when it comes to health issues. If we had that in place, a lot of this stuff wouldn't have happened. Anyway, I really appreciate you coming on. Dr. Mark Richards, your book, Nobody Wants You Healthy, available pretty much anywhere, yes?
Yes. If they go to my website, nobodywantsyouhealthy.com, they can see podcasts where I talk more in depth about this and interviews, and also a link to buy the book.
It was great to speak with you. Thank you so much for your time.
Thank you, Cheryl. I look forward to speaking with you soon.
Medical choice in America must stay intact if we are to preserve our liberties for the future. If you like Bold and Blunt, you can get Bold and Blunt at edify.app, at washingtontimes.com, at Real Life Network, and, of course, wherever podcasts are offered. Tune in next time. And in the meanwhile, don't forget, stay blunt, stay bold.